Hi, my name is Brooke and I'm going to be your student nurse today. I will be assessing your 12 cranial nerves and your reflexes. I'm going to perform hand hygiene. First, we'll test the olfactory nerve, cranial nerve 1. If you could close your eyes, cover your nostril, and tell me what you smell.
Cinnamon.
Good. And the other nostril. Pepper. Good. Cranial nerve 1 is intact and equal bilaterally. Next, we'll test cranial nerve 2, the optic nerve, by doing the confrontation test. If you could cover your left eye and tell me when you see my finger.
I see it. I can see it. I see it. I see it.
Great. And the other eye?
I see it. I can see it. I can see it. I can see it.
Great. Cranial nerve 2 is intact and equal bilaterally. Next, I will test cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducent. By this, I will be inspecting your eyes. The sclera are white with some blood vessels present. You can pull down. The conjunctiva are pink and moist. Pupils are a size 5, round and equal bilaterally. Next, if you could look ahead, I will shine this light in your eye. Alright, pupils are reactive to light directly and consensually. Next, I'll have you look at the door handle, then look at my pen light. Good. Pupils are accommodative. Next, I will have you follow my pen light without moving your head. Good. Pupils follow the 6 cardinal positions of gaze with no nystagmus. Next, we will test cranial nerve 5, the trigeminal nerve. I'll have you clench your teeth. Mastication muscles are strong and equal bilaterally. Then I'll have you close your eyes and tell me if you feel this equally. The ophthalmic, maxillary, and mandible. I feel it. Good. Cranial nerve 5 is intact and equal bilaterally. Next, I will test cranial nerve 7, the facial nerve. I'm going to inspect for symmetry, which there is, and I will have you smile, frown, puff out your cheeks, and raise your eyebrows. Alright, facial features move symmetrically. Next, I will test cranial nerve 8, which is the acoustic nerve. I'm going to palpate the external ear, which includes the pinna, tragus, and mastoid process on both sides. Did you have any tenderness? Nope. Alright, external ear looks good with no abnormalities and no tenderness. This is where I would use the ophthalmoscope or otoscope to inspect the inner ear and note my findings. And now we're going to perform the whisper test. I'm going to stand behind you, and if you could close your right ear. L3W. L3W. And the other ear? B4Q. Good. Cranial nerve 8 is intact and equal bilaterally. Next, we'll do cranial nerves 9 and 10, the glossopharyngeal and the vagus nerve. Do you ever gag on your toothbrush?
Yes.
Good. Gag reflex is intact. Then I'll open your mouth and say, ah. Good. Uvula raises midline. Next, I'll test cranial nerve 11, the spinal accessory. If you could shrug your shoulders, look to the left, and look to the right. Good. Muscles are strong and equal bilaterally. Next, I'll test cranial nerve 12, which is the hypoglossal nerve. And for this, I'll have you stick out your tongue. It's midline. Cranial nerve 12 is intact. Lastly, I'm going to test your reflexes. First, I'll test the triceps. So I'll have you wiggle your toes and relax. Good. 1+ on that reflex. Relax. There we go. 1+ on that one as well. Next, we're going to do the patellar reflex. If you could pull your hands. Good. 1+. Good. 1+. Reflexes are intact and equal. This concludes our assessment.